colleague Sempoten, and I congratulate him and I welcome him to the podium. Thank you.
Ladies and gentlemen, Assalamu alaikum. आज थोड़ा सा पहले मैं आपके साथ एक ऐसा प्रोजेक्ट आपके साथ जब मैं शुरू कर रहा था बहुत सारे लोगों ने कहा कि नामुमकिन फाइनेंस के लोग शायद इकोनॉमिक्स के लोग इसको समझते थे कि ये बिल्कुल ही क्योंकि इकोनॉमिक्स वाले कहते हैं दो आए तो दो जाए में ये नहीं हो सकता कि आए और समझ जाए और लोगों ने मुझे साल 2 साल मैक्सिमम 2 साल दिया कि 2 साल के अंदर इसको चार्ज करना शुरू कर दें अल्हम्दुलिल्लाह 6.5 साल Ladies and gentlemen, before going into the what and how, and before sharing the future, I'll address the core issue of why. Why do we do what we do, and why we want to take this initiative for the next year. These 3 words, these Allah, are the sole reason for all the efforts of the past and the plans for the future. These are the axis around which our mission, our vision evolve, and decisions are made. The ground realities and the backdrop against which our path has evolved does not make for a pleasant reading. Yes, we live in a world of constraints and are surrounded by the multitude of challenges. The government and the society have been trying to bridge the divide between the demand and supply, but these are huge disparities. And while there are reasons for such a situation, and whether they are justified or not, what is not disputed is that those affected are the least fortunate and are the vulnerable in society. These numbers also represent an opportunity for the dream to germinate, take root and blossom to initiative that makes people believe again. Just to share the journey and how this journey began. It began from my student life in Karachi College. While studying in a public sector university and seeing the public sector during the formative years of my personal realization, allowed the experience to shape the development of an empathetic conscience. Witnessing firsthand extreme need coupled with helplessness and our inability to make a real difference shook us to the core. Were we playing the roles of saviors in times of desperation? All that should have been done could not have been done. The paradigm had to shift. The drug bank and the blood bank created by Patients Welfare Association of Dhaka Medical College was a step forward for those who needed it the most. However, it was the first bomb blast in Bori Bazar in 1986 that exposed the realities of inadequacies and paucity of resources. Lack of resources, systems, and structure paralyzed the best of efforts and individuals. People in distress turned to doctors for answers, for hope, but things beyond our control. This is where the dream was first born, for a group who wanted to take control and get results. While the experience of the public sector was extended to upgrading the accident and emergency department of Civil Hospital Karachi and the cardiac surgery department of the Civil Hospital, the canvas had to be broadened for the colors of the dream to be expressed. And the dream was to build a health system to provide quality care free of cost. Dreams are not what make you sleep all night, rather what keep you awake. Dreaming of a vision that entailed exceptional care without exception and turning it into the reality was given a godsend opportunity in the form of a merger of Rufada Foundation and Islamic Mission Hospital Trust in 2005. These 20 acres of the land represent the first step towards a vision that aims to break the disparity with dignity. A system that provides empathetic care to those in the need, free of cost, where decisions are made based on the clinical need rather than the ability to pay. This was to be formulated with an emphasis on quality to a standard where this is the destination of choice and not a choice made in desperation. Our mission and vision are based on pleasing Allah subhanahu wa ta'ala by providing care, quality care free of cost. And with this framework and outline, we started living the dream in 2007. Our numbers have grown at a pace far beyond what we had expected. Yearly outpatient and emergency visits close to 400,000 and 12,000 admissions are higher turnover numbers and demanded efficient system. Allah has enabled us to keep pace with the increasing financial demands with support from all parts of the society. Our work and efforts are not in isolation. We have partnered with many international bodies for increasing capacity and learning. This includes some leading institutions such as Harvard University, Johns Hopkins, University of Iowa, University of Texas, World Health Organization, and many more. The dream is bold enough and is enabled by many unique features. We pride ourselves in being paperless and cashless. There is no cash counter in the hospital. Patients do not need to spend a single rupee during their entire treatment journey. For consultation to admission, procedures to diagnostics, there is no expectation of payment from the patient. Using cutting-edge health delivery technologies has enabled efficiency and intervention in the patient's doorstep. Patient's need and disease severity are the sole decision makers. This model and system extends beyond the boundaries of 20 acres and affects complex life. Now from there we are embarking on the next step of this journey, which will greatly increase our capacity to deliver quality care free of cost. This is the hospital for the people and by the people. Support of individuals, institutions, and the government is integral in transforming this dream into reality. We all have our parts to play. The reality is that working to please Allah is directly working for Allah. We are lucky to be chosen as His instrument to deliver and implement. We all have very important roles to play. We believe in contributing to the development of society. Imperfect conditions are opportunities for individuals and institutions to rise and be counted. counted to this in this world and the hereafter. हस्बुल्लाह व निअमल वकील व निअमल मौला व निअमल नसीर। काफ़ी है मेरे लिए मेरा अल्लाह, बेहतरीन कारसाज है, बेहतरीन मौला है और बेहतरीन मददगार है। Now the future, the expansion of this hospital from 150 bedded to 1,500 bedded hospital. What we realized in this 6.5 years of journey, that the major challenge is not the money. To deliver sincerely and in a transparent way, there are many people there to help you out. The major challenge is the human resource. And the human resource you can get from the market, but what you get at the age of 30, you cannot change. It takes a lot of time to undo what they have done and to start from zero and make it to what you want to have. So initially we didn't have a vision of having an institution where we will develop our human resource. But what we faced during this 6.5 years, we decided to make our own nursery where we can take a 17 and 18-year-old kid and groom it to a passionate doctor, a passionate nurse, a passionate paramedic, which would deliver. Unfortunately, we couldn't find the capacity in Pakistan to make master plan, and we had to look outside world for the master planning, and we have been fortunate to have people from Singapore, company from Singapore, who made a master plan for us. The experts in making hospitals have done hundreds of hospitals in Singapore, Malaysia, Indonesia, and they were from Asian side, so they knew what we want. So just share a few of how did it started. And I hear 1.5 years ago, we got contacted with them. These are the hospitals that they made. They make green hospitals with energy conservation, water conservation, and foundation. This is the hospital that they are in the process of making in the hospital, and they came with a brilliant idea of providing every patient a way to live. Because the healing, the greenery, providing a healing environment. Took us about 1.5 years to reach here for that last Sunday. We break the ground. The work has started for 1,500 hospitals. In phase 1, it will be 600 hospitals. These were the principles around which the master plan, that is flexible, patient-centered, vibrant medical complex, and healing environment. We will be having a hospital which will be a 10th-floor building and a university which will be a 15th-floor building. There will be green, 2 networks, that we have the sky gardens, the district network, process. They have studied the natural ventilation analysis they have done over the whole year around, and came up with a draft design that natural ventilation would be. Phase 1 we'll start with the 600-bed facility along with the 1 tower of a university. In phase 2, 600 bed more will be added with another tower of the university. In phase 3, the existing building will go down and 600 bed will be added in the university. पास वापस आए और उन्होंने ये कहा कि डॉक्टर साहब आप सही कह रहे हैं। और मेरा उनको ये जवाब था, मैं नहीं कहता था, मैं ये कहता था कि अल्लाह करे। अल्लाह ने ये करके दिखाया। आज इस वक्त महाना खर्च 7 करोड़ रुपए है। 7 करोड़ रुपए महाना खर्च इस बिल्डिंग को, ये तमाम प्रोजेक्ट को जो 10 साल में पूरा होगा। ये 50 बिलियन का प्रोजेक्ट है। कितने जीरो है मैं भी नहीं बता सकता, गिनने पड़ेंगे, लेकिन मेरा यकीन है कि ये होगा इंशाअल्लाह। क्योंकि ये न मैं कर रहा हूँ, आप कर रहे हैं, जो हस्ती कर रही है उसमें सिर्फ कुल फैमूल। शुक्रिया।
Thank you so much. Mashallah, it's wonderful work and it's an honor to have you here. Mashallah, thank you. Now I'd like to go ahead and introduce our moderator, Junaid Qureshi. He is a true open member from Pakistan to the US. We're always honored to have him. He's also a CEO of the SSJG Group. He is also part of the Hum Network, and we want to again thank them for their support as well. He is also a big reason why his mother was available for us today. And Junaid, I'd like to pass on that to you. Thank you so much.
Thank you very much, everyone. First, I would like to just thank an amazing person, Dr. Bari, who has done all this. He definitely Allah ने ये सब करना है, but until बंदा आगे नहीं बैठा करने के कुछ नहीं करता. Please take off. So I have an amazing panel here. So over the past couple of days, we were exchanging emails. So I asked everyone to send me the bio. In सबके bio इतने बड़े थे, and the last 2 sessions are running so long. So I'm gonna give a very small presentation, information about you guys. But I asked everyone to share with me one of the unique things they have. So I have some of the information from everyone. So first of all, Dr. Mehta. Dr. Mehta is a CEO or chairman of KITE, correct? Chairman? President of KITE. President of KITE. He is a very learned person, MBA from Chicago, University of Chicago, PhD from Cornell University. He has spoken on many Ivy League schools. And at the same time, he has been in many think tanks about entrepreneurship, not just in Pakistan, but also in throughout Islamic world and throughout the world. So he has done many think tanks. He has traveled extensively to exotic countries, and among them is Israeli-occupied Palestine and Kashmir. I'm sure he has many stories to tell about that. Farooq Khan, I'm sure no introduction is needed, but I'll still introduce you a little bit. 25 years of entrepreneurship experience in this industry. He founded BMA Capital, was CEO of BMA Capital, has won numerous awards on his successful ventures in this field. He's currently the CEO of Acumen Funds, one of the fund companies that I love dearly. And he's an avid collector of contemporary Pakistani art. And I've been to his house and I love his art. Half of it we will not understand. Sikandar Sultan Saab is the reason that I make frequent visits to grocery shops in California. इनकी मैं खूबी बताऊं कि entrepreneurship venture की खूबी शान फूड जिसके CEO और फाउंडर हैं कि अमेरिका में बहुत सारे इंडियन ग्रोसरी स्टोर्स हैं और काफ़ी इंडियन ग्रोसरी स्टोर्स हैं जिन्होंने मैंडेट बनाया हुआ है कि वो पाकिस्तान की कोई प्रोडक्ट कैरी नहीं करेंगे एक्सेप्ट शान फूड्स. So I'm happy that my daughters love nihadis and chicken tikka masala flavor, but I tell you, there are many times when I मेरी wife बोलती है खत्म हो गया मसाला चावल अच्छा interesting thing about Sikandar Sahab he is a pilot and a scuba diver. Rehan Sahab started his entrepreneurial career at the age of 13. Then at 16, second company. Today, over 51 companies and still not stopping. So, as soon as he said 51, I told him not to tell me any more companies. I will not mention it. The last company is doing, Super Technologies, right? He's the CEO founder of that. And I think he is one of those guys that if you Google him, you can find the most information about him in Pakistan. And he has over 350,000 followers on Facebook. He's become the 350,001. Benji William, my crazy friend from California. He came here as an Acumen fellow. He worked on many projects with Acumen. Pharmagen was one of them. This water purification program shops. And you should read about it. It's very fascinating. Went to Stanford for his MBA. I loved it. We had a good company there. But all of a sudden, I one day got an email from him, Geneva, I'm going back to Pakistan. And I'm going to start Amal Academy. He's a founder and co-founder and CEO of Amal Academy. And he lives in Lahore. And to this day, it's been a year now, I don't understand why he did this. So he's going to share that story with us. He is an American, but he does have 9 siblings. So anyone who thinks that we are the ones that are he loves all. So we have a great audience. We had a few questions back and forth, but I'm going to start with a very simple question. सब discuss करते हैं entrepreneurship की, social corporate responsibilities की, and different kind of donor programs and everything. But there is always this different kind of entrepreneurship, as you saw, agriculture, technology, and everything. So I'm going to ask audience just to help us define social entrepreneurship. All of us think we know, but you'll be fascinated that I had a discussion with everyone, and the response was different. And I'm sure in the audience, the understanding is different. But it'll be nice if you can spend just maybe a minute or two to start to define what you think the entrepreneurship is. And if you don't mind, I'll speak a little in English and Urdu since Benji only understands English. Thodi Urdu. So I'll start with Benji if you don't mind.
Right. So the question is, define entrepreneurship or social entrepreneurship?
Of course, social entrepreneurship.
Right. Well, I don't think I'm the best person to answer this question, given everyone on the panel and everyone in the audience. But I will say this is something we discussed often while I was doing my MBA at Stanford. I took a number of courses, and Stanford's known for having this focus on. They've rebranded it as social innovation, which essentially means the same thing, social entrepreneurship. And what I concluded after the 2 years is that the term is actually just a term, and it's just a label, and it's just part of the semantics. And I once had a friend, and she said, you know, in the 70s I was called an activist, in the 90s I was called a developer, and today I'm called a social entrepreneur. But I've been doing the same thing for all 40 years. And so this idea of labels and this idea of terms, I think it's important because it helps frame discussions and it helps put things into context. But I think it's also important not to get too caught up in it. And so essentially that's my way of backing out politely from this discussion and handing it off to someone more expertise.
Thank you very much. Initially, being a professor, they never one ancestor, they don't know. Ask a question. And I don't know, somehow or the other, I was thinking that this question may be asked. And I said, why not look at what the book is. It's very interesting. So I just put one very interesting thing about what I think social entrepreneurial is against other entrepreneurs. The social entrepreneur is persistence. If they start doing something, they will keep on. Because perhaps they feel that there is no concept of failure. Businesses are closed, but I have not known social entrepreneurship or relationship like that. So that's one definition which is very important to take into account. For example, the founder of Ashoka, he says that it's not only how to teach people to do fishing, but keep on persisting that they keep on fishing. That's the difference. So that's what the social entrepreneur is. See that when they start, and we have just an example given by Dr. Bari, that he started a long time ago for his school days. That's what I want to do. And although he became a cardiac surgeon, but he never gave up. And that's what it is. And I think I try to, I'm also trying to do the same thing. Being a social scientist, a long time ago, they have tried to work with some people, some group of people that can make a difference. And that came to our 100 years, the Department of Community Sciences, and I was one of the persons who started the community sciences program, working in Karachi, it was very unfortunate that it was a grant-based program. The money was given by USA, and it closed it because USA had found it out. And I was really disheartened because this program now I'm back here with a different mission, getting people about I'm also not as much persistent as Dr. Bari, but I have been persistent at least. I think if you have people like Bari and Sadeep Rizvi and Swati and many more, I think the best example from the region is came with a PhD degree in economics, and we saw that he doesn't need to be a planner.